So first I'm going to introduce myself as we're at 3 after already. My name is Kris Torgeson. I'm the global CEO of Lifebox, and I'm very proud to be joined today by two of my esteemed colleagues. First, Senait Bitew, who is head of programs for East Africa. Senait is a nurse by background. She was instrumental in the development of Lifebox surgical infection reduction program, Clean Cut, and now leads on Lifebox's strategy for the East Africa region. You can say hello.
Thank you, Kris.
Hi, sis.
Hi, everybody. Thank you so much, Kris.
And second, I believe almost everybody knows who works in global surgery. I must say, you almost don't need an introduction. We're very, very pleased to have with us today Professor Miliard Derbew, who is a leading global pediatric surgeon, currently CEO of King Faisal Hospital in Rwanda. And he is also, we're very happy to have him as a member of the Lifebox Global Governance Council, which is our board of directors, our board of trustees that oversees our work. Among his many, many distinguished positions, Professor Derbew was a founding fellow of the College of Surgeons of East, Central, and Southern Africa, which many of you know as COSEXA, of which he has served as president. And I'd need an entire half hour to read Professor Miliard's CV, so we're gonna have to keep it short at this point, but also be very grateful that he took today with us. So welcome to Coffee with Lifebox. We're giving a quick overview today of our new strategic plan, and really quick, centered on stronger teams, safer surgery. This is a short, and I'm told to be snappy event, but we want you to get to know Lifebox, our team, and our work. So please put any questions that you have for us in the chat. We have limited time today. We'll try to get to a couple, but we hope your questions can also help guide us for future events. So please put a question or a topic that you would love us to cover in future events. We have a great, wonderful team and many people to bring on. But first, just by way of introduction to Lifebox, for those of you who are not very familiar with us, we are a nonprofit organization. We focus on improving surgical and anesthesia safety around the world with a concentration on low and middle income contexts. We are a surgical organization, I often say, that doesn't actually carry out surgery or anesthesia. What we do is or send in foreign teams to do that. What we do is we work directly with surgical teams to address the gaps in surgical safety that they consider most important and critical for helping them to deliver the best possible safe standard of care for their patients. We started 10 years ago with our founder's vision around the World Health Organization surgical safety checklist. So we're often known as addressing checklist implementation questions. And we began by tackling one key element of the checklist that we're best known for, working to close the pulse oximeter gap to improve anesthesia safety. So many of you know Lifebox as the pulse oximeter organization, which we now call the Lifebox Smile Train pulse oximeter as part of our global initiative. And we're very happy that many of you are partners with us through our pulse oximetry work. Our new strategic plan, and you can see the slide here and the link in the chat, expands on our work on surgical and anesthesia safety and sets ambitious objectives for expanding this work by 2024 to focus on 3 key areas to address the highest causes of mortality and morbidity related to surgery and anesthesia. And these are the 3 pillars of our work that you can see in the middle of the screen here. First, anesthesia safety, where we started, continuing to invest in addressing gaps in safe patient monitoring by increasing access to pulse oximetry. And now with our major initiative with Smile Train, identifying a capnography solution first for use in safe anesthesia care for cleft patients, but one that we feel if we are able to identify the lowest cost, most well-adapted capnography solution, we hope this will be with many of our partners around the World Federation of Societies of Anesthesiologists, CASEXA, et cetera, working to address the capnography gap around the world. Second, the second pillar of our work is around surgical safety, and particularly focused on surgical site infection, which we know after anesthesia, safety is one of the greatest causes of mortality and morbidity related to surgery. Our program called Clean Cut, which I think we will address in a future call, has been shown to reduce surgical site infection in hospitals, particularly in Ethiopia, by as much as 40%. And this is a major initiative for us, and we hope to expand it to up to 20 countries over the next 3 years. This is a major part of our new work. Last, but certainly not least, and in fact, the center of our work on our third pillar is around teamwork. And you can see it here. And surgical teamwork is the core of safety, as we all know. I think most of the people on this call recognize that. But what we're looking at now is really looking at how we can not just address teamwork within the OR, which is where the surgical safety checklist mainly focuses, but look at the safer end-to-end surgical patient journey. And here I really want to highlight our new emphasis. Yes, continuing on the entire surgical team, but with a real emphasis on nursing care, as we all recognize the critical role that nurses play in delivery of surgical care before, during, and after the actual procedure. And how do we do this? We can talk more in detail, but the way Lifebox works is always in partnership, whether that's with another NGO, with a Ministry of Health, with a particular hospital, with another organization, and to provide what we consider really key opportunities with tools and training to help improve all three areas of our focus for the coming years. So you may think of us as a pulse oximeter organization. Hopefully at least this snapshot gives you a sense of our direction and the scope of our work going forward. So with that, I'm going to ask my esteemed Board of Trustee, Professor Miliard, whether he would say a few words about the vision of Lifebox from the global governance perspective of Lifebox.
Thank you very much, Kris, and thank you for giving me the opportunity to join you in a coffee with Lifebox. As you have already mentioned, the activities of Lifebox are expanding. To give you some of the visions of Lifebox on global governance is we focus on addressing the critical gaps in surgical patient journey, as you have said, end to end. So we work on delay in seeking surgical service and delay in reaching to a surgical service, and also delay in receiving care in the surgical care service. We mainly focus on receiving care area, like giving, as you have said, on safe surgery, safe anesthesia, and also teamwork areas as well as, but we work from seeking medical service up to getting a proper and affordable medical service. Investing in leadership also in Global South. Lifebox works on building capacity in the Global South, and 80% of all positions, including leadership, to be based in Global South. So this is the main target, which helps or makes the country have a sustainable surgical service. Investing in surgery, as you know, saves lives, and it's affordable, and also promote economic growth. That's why Lifebox invests primarily in these areas. And to bring capacity, to build capacity locally, we jointly work with local organizations like College of Surgeons of East, Central, and Southern Africa, COSEXA, which has like 14 countries in eastern part of Africa. It's in Sub-Saharan Africa as well. East African, also in Ethiopian Society of Gynecology. We also work with West African Association of Surgeons, WACS, and this is mainly local organizations which are working primarily in addressing surgical service by either by improving the workforce or improving training and also improving capacity and also equipment. So these are the main visions of Lifebox, which we are planning in the coming 1 or 2 years to address jointly with our partners. Maybe to see the activities which we are doing in Eastern Africa, may I give this opportunity to Sister Senait to touch and base in the strategy of East African region of focus of Lifebox area. Senait, please, can you say something?
Thank you, Professor. It has been a while since I was called sister, and it just chills me. Thank you for reminding me, though. As Kris and Professor Miliard was mentioning about the strategies that we are using and to reach out not only for the Eastern Africa, but globally, one of the major investments that we have been working on the past at least 3 years and 4 years around is in Ethiopia. And having these projects, the different projects that Kris was mentioning earlier around the surgical safety and surgical site infection reduction project, and others as well. The new project, which is we all very much excited about, the nursing, the perioperative nursing project. These are being kind of piloted in Ethiopia. And now Ethiopia is a hub in implementing, practicing this, and through the challenge and the lessons learned, now we are at this stage of expanding and exploring other countries to implement the projects that we have. And as both of them were saying, the huge strategy that we use is partnership. The partnership we have with UGHE, which is the University of Global Health and Equity in Rwanda, which we're looking forward to duplicate what we have been implementing in Ethiopia, be it the CleanCut project, which is a 6-month quality improvement project, and that we have shown a great deal of surgical site infection reduction, which is up to 45%. We're planning to start partnering with hospitals through the UGHE partnership, and then even the COSEXA partnership, because these are surgeons that we have been having different partnership with. Again, we have had a couple of trainings that we have delivered with in collaboration with COSEXA, and we hope, again, not only to reach out to East African countries, but as a whole in sub-Saharan African countries, because COSEXA is beyond just the Eastern Africa. And also the partnership that we have in country in Ethiopia, like the Society of Gynecologists and Obstetricians, which is showing us a great deal of another perspective of CleanCut, which we are contextualizing it as a CS, CleanCut CS project, which is a research project and going to take us 2 years to see the results, the lessons learned and everything. But then that we hope, again, will take us to another Eastern Africa and Sub-Saharan Africa countries to be kind of cascaded, because this is a pilot project and then we'll see. And another contextualization of this CleanCut project is a CleanCut for cleft, which we are, again, very much excited to start in the coming few months in partnership with SmileTrain. Again, this is not only in Ethiopia, but in the Western Africa. We try to include in this project one facility in Cote d'Ivoire. So this is the strategy practically that we are using, is using Ethiopia as a hub, standing from where we have had a lot of experiences in implementing real projects, and then taking it to further to other countries. Now CleanCut we have with a partnership with, again, another huge partnership that we have with Mercy-Ships. We are trying to implement CleanCut in Liberia and Madagascar, and these are going great. And as I said earlier, the nursing project that we have started yet collecting data or a survey, we have been joined with, we are grateful to be joined with a very much senior, well-experienced nurse who is with us in the audience now. I'm sure she'll speak later on. But we are having an advisory board, which is led by her, Banmi. We're so grateful to have you with us, and we're very much excited again to pilot this project and to take it to the other Eastern Africa and beyond. So thank you so much. Maybe Kris, back to you, and I'll come back with other questions. Thank you.
Thank you so much, but I think I'm going to throw it right back at the both of you and ask you to speak a little bit more on the emphasis on and obviously Comrade Bunmi is on with us, but our new nursing advisor, and I think we'll do a special coffee with Comrade Bunmi. I think people will love that. So I know she'll say yes on this. I also want to give a shout out to one of our really important partners, Dr. Edna Adan, who we're delighted to see is in the audience today. I won't put pressure on you to speak out in this call, but we're going to invite you for a future coffee, since it's been one of our key partnerships in Somaliland that we've really worked on and hope to expand on in the future. But I wanted to ask a little bit more about the nursing care. And first, maybe Professor Miliard is to ask you, as a surgeon working in an operating theater and running a hospital, why do you think it's so important? And remember, you've got a lot of nurses in the audience here, so why is it so important that Lifebox really, together with Smile Train in our new initiative, really focuses in the strategic plan on improving and partnering with nurses to improve surgical safety?
Yeah. As you know, the main objective of Lifebox in our strategic plan is partnership. And I take in all partnership, from the community all the way to the operating room, the nurses play as a wild card, fit in all gaps that are covered by the nurses. So having nurses involved in this service is very important, and the role is nothing would be achieved unless we are actually not working, actually should be guided by the nurses. So because they know everything from bottom up, so all the services, but we have said end to end. So having nurses is very important. And as Senait said, we are also working on partnering with Smile Train, primarily focusing in pediatrics. Why do we focus in pediatrics? Maybe another area which you have to answer. It is said like 1.7 billion children worldwide do not have access to safe, affordable, and timely surgery. So majority of this, over 60% of this, are in sub-Saharan Africa. And when it comes to specifically to Africa, injuries, congenital anomalies, and surgical infections are the most common surgical problem that African children suffer. So to address these problems, if we address the surgical need of pediatrics or children, then we can address 60 to 70% of surgical need of the continent, because they are the most vulnerable and needy communities. So it is very important to address these issues and work together in partnership. As you know, Lifebox also plans to improve pediatric surgical and anesthesia care, because these are the two things which go together. To achieve this, we work on addressing workforce need, either by augmenting their service or by training new ones or supporting training centers like COSEXA to address the surgical workforce needs, especially pediatrics as well. And also we work, as already said by Kris, about equipment and infrastructure. We're called like pulse oximetry institution, but now we have gone beyond that. We have pulse oximetry, of course, capnography. Now we are working also on surgical light. So everything, capacity building in surgery, improving outcomes are one of the areas which we are working together. We build in all areas on capacity building. So Lifebox with the SMILE train, safe surgery and anesthesia initiative work to elevate the standard of pediatric surgery and anesthesia care. This will be achieved through improved surgical teamwork and increased access to patient monitoring and other things. So everything what we are working is not only to have surgery, but to have safe, affordable surgery and reduce surgical mortalities. We don't want any patient who have reached to the level of surgical service to have problem like death or morbidity or mortality. That is our main area of focus, which we are working together. Thank you, Kris.
Oh, thank you so much. And I just want to really, underscore what Professor Miliard has said about our focus in this plan, obviously continuing with safe anesthesia and building tools and training components that are really relevant to the context that we're working in, but emphasizing the role of nursing more and more, and emphasizing the investment in pediatric care, and underscoring that the multi-year partnership that we have with SMILE Train is really allowing us to invest in this area and expand our programs. Sister Senait, since now we'll use this, would you say a few more words on, obviously we always talk about the things that are what we're looking forward to building on the success of with Clean Cut, which was you were instrumental in, and together with support from the GE Foundation, now support from several others, to expand our Clean Cut work in Ethiopia and then other countries. What would you say is the greatest challenge for Lifebox and our partners as we look to expand Clean Cut within Ethiopia, but as you mentioned already, in other countries, including Liberia, Madagascar, and elsewhere?
Thank you, Kris. But I just want to say, I loved what Professor Miliard was mentioning about and explaining about why we wanted to get engaged in the nursing aspect, and, they are the huge part of the surgical team. But also to come back to your question, Kris, the huge challenge that we have had in implementing Clean Cut in Ethiopia, and then now even taking it to Madagascar and Liberia, the huge challenge that we were facing, and then we still are, is, the concept of quality, because Clean Cut is a quality improvement project, and then quality needs, commitment, the leadership, the manager. It's not just the OR, the operation theater team. It is not only the surgeons, it is not only the nurses or the anesthesia providers. Rather, it has to have a commitment of the hospital CEO or the hospital medical director, or some of the teams that the Ministry of Health in Ethiopian context were trying to advocate, the SALT team, the Safe Surgery, Saving Lives Through Safe Surgery initiative. We call them the SALT team in Ethiopia. So the commitment of all is like mandatory in a way, and quality by itself is not something that you can bring easily. We have known this would have been a challenge, and it still is a challenge, and then we're learning in different ways to improve our engagements with the management team and with everyone. So I would say the major challenge was by itself, the concept of implementing quality improvement project is not in a very resource limited hospitals and countries. This is very much expected. Again, the other issue I might, maybe this is somehow related to the Ethiopian context in some African countries, the specialty differences of the nurses, speaking of the nurses, it is difficult to find those well-trained OR nurses. And, the trainings that we provide, it includes nurses, but then also, you see there are challenges regarding the education background, regarding, their capacity and skills. So the trainings that we give, we have to conceptualize, contextualize it in a way to deliver and to make it effective and, you know, applicable in all senses. So these are some of the challenges that we had.
Thank you so much. And again, we wanted to keep this short and snappy, give you just a snapshot of our new strategic plan and some of our goals, and share with you. We hope you will bring questions to us going forward. As Senait just said, and Professor Miliard already mentioned, you know, a big part of our emphasis in the coming 3 years is on investing in leadership and developing innovation and programs that are best suited for the contexts in which they are being implemented by the teams who are implementing them. So if you have an idea, if you have a gap in surgical or anesthesia safety that you think our programs can help address, we hope you'll reach out to us and that we can work with you. We only go where we're working with partnerships. Kitty just put up the address, so you can reach out to us. We really we'll only achieve our goals in this plan, which are ambitious and were just shared, if we have your partnership. We obviously always are very grateful to all our donors and anyone who gives a gift to Lifebox, which you can find the way to do so on our website or by reaching out to me. And I want to just mention that we hope that we'll have future coffees. We have goals also for climate smart programs, for helping to make inroads in changes that have been occurred because of the impact of the COVID pandemic, both good and bad, as we've seen in many ways. So we have lots of topics we can explore in future coffee. So thank you all for joining us today. Thank you, especially Professor Miliard, who really was drinking coffee during our call. I'll lift my mug to you both, also to Sister Senait. And we wish we could send you all a good Ethiopian coffee, but we all wish you a good day. And thank you all for joining us, and send us information on future events.
Thank you very much. Thank you all.